Welcome back to Beyond Small Talk, where real conversations lead to new perspectives. My guest today is Dr. Chris Whyrick, a natural health practitioner.
Hello.
Glad to have you.
Thank you. It's a pleasure being on your podcast today. Thanks for reaching out.
Dr. Whyrick, what are the differences between modern medicine and the holistic and natural approach that you use to practice?
Okay, certainly. So modern medicine, I believe you're referring to modern Western medicine approaches. Am I correct?
Yeah.
More on the Western side. Certainly. So, what we consider modern Western medicine probably came into being beginning of the 1900s and has constantly been evolving to what we have now. And the approach at the time, especially when they learned about, probably around the 1930s of, I don't want to be incorrect there on my dates, with the advent of penicillin, there was this revolutionary idea that, pathogen invades the body. It got past our barriers. We have to meet it where it's at. We have to fight this battle to overcome. Okay. And that was fine at the time, in my opinion here. That was fine at the time. But what has happened over time is that the battles are becoming greater, as are the drugs. Okay. And the approaches, they're becoming stronger. Okay. To the point that now we're seeing, if you ever seen a pharmaceutical ad, you're seeing major side effects as potentialities to the use of these treatments. It's becoming stronger medicine, stronger pathogen, stronger medicine. The dichotomy with natural medicine, at least the way I approach, is it's not a war we're trying to fight, but it's a balance. It's a dance. Okay. Health is a dance. It's a balance. Okay. So we have everything we need within us. Sometimes we need a little bit of help. Okay. So our approaches are to supplement that is lacking and give the body a little bit of help so the body can then restore balance. So instead of fighting this battle, it's how do we healthfully live within this paradigm of balancing or competing and balancing forces. Okay. And so our approach is certainly that I'm going to work with the body to help build it up so then it can overcome in its own light. Okay. Rather than forcing the body to go in a direction that it wouldn't necessarily be going in the first place.
I know you mentioned balances. When you think about modern medicine versus the holistic approach, and the body's approach to receiving both of these, is it more receptive to the natural approach?
I would say that the body is more receptive because the fact that we have side effects to like pharmaceutical drugs would point to that. Okay. We don't see the same level of side effects with, say, herbal medicine, as long as herbal medicine's being practiced correctly.
Right.
If we're working with the body, we don't anticipate side effects, or if there are any side effects, very mild. To me, the fact that there are strong side effects is telling me that we're going against the natural tendency of the body. Okay. You may be overstimulating or over suppressing, say, one receptor. Okay. Now, again, is that how the body wants to function? Does it want to be constantly suppressed or stimulated? In my opinion, no. Okay. It just wants a little bit of stimulus here and there that will allow it to come back into function, full functioning. So yeah.
Well, you talk about the stimulants that the medicine is that we're our body, but for someone facing low energy, how would herbal medicine support increase in their energy levels?
Certainly. So the first question is, how do we produce energy? Okay, it's certainly part and parcel of the digestive process, and it's a systemic production, right? Or where all these organs are working together to produce what we would consider energy. Now we can go to the cell level and look at what we call mitochondria, which are structures within the cells that are producing what we call ATP or energy. But that input comes from a number of different systems. So we know that you know energy is produced in the starts in the stomach, where you have the separation and breakdown of food, okay, and then goes in the small intestine, where absorption and further breakdown happens, and then it gets uptaken by the system. And then you know the brain's getting involved here. It's telling the body to turn things on and off. The thyroid gets involved, the adrenals get involved, and then you say the liver, the pancreas, the spleen, the kidneys, the lungs. So you know it's a systemic a function within the body, right? So how does herbal medicine work in that way? Well, we support these natural functions. So say somebody doesn't have the best digestion for whatever reason. Is that so? Herbal help with the production of energy.
Yeah.
So again, if we look at in Chinese medicine, we may use an herb like ginseng, renshin in Chinese medicine, or white ginseng, renshin bai. And what does renshin do, or ginseng? It helps stimulate the forces of the stomach. It helps fire up the stomach and the digestion. Okay, so we all know that ginseng, so-called, helps give us energy, but it doesn't really give us energy per se. It stimulates the better functioning of the digestive system. So we see a lot of people, as they get older, digestive processes decline. Kidney function declines, liver function declines. So we use herbs in a tonic function to build this back up, to stimulate this again naturally. We're not forcing it in a way that it doesn't want to go. We're just helping give a little bit of momentum. Okay, and again, if you're not digesting, you're not producing good energy. So I look at patients who are on proton pump inhibitors, H blockers, whatnot, these like acid blockers, and when somebody's taking something like that, they're hindering part of that digestive process, so you're never fully digesting. And so many people have digestive issues these days. So what herbs do is they either will help clean out anything that's like toxic within there, and or then stimulate and help support the digestive functions. And therefore, then we can produce good energy.
If I'm understanding you correctly, so your gut health is directly related to your energy levels.
Absolutely. It all starts in the stomach. There's a saying in Chinese medicine that all energy starts in the stomach, all fluids start in the stomach, right? So we talk about hydration, right? Hydration's a key component in energy production. Without having enough, say, oil for your engine's going to freeze up. It's going to overheat. Okay, it's not going to be as functional. It's not going to be as efficient, right? So if we don't have that function of the stomach, in a term we use in Chinese medicine also, is the stomach rots and ripens what it puts in it. Okay, so it starts this breakdown process, and then from there, then the body can take these components that have been broken down and send them to the tissues and to the cells where energy is produced. You can't make energy out of a rock, right? Or you can't make energy out of a pea that's not been broken down. Sometimes we'll eat something and then we'll see it come out the other end, never broken down. Well, obviously, we've not produced good energy out of that. If anything, that's taken energy to get it through. It's not produced energy. So obviously, we need to break this down into its component parts to extract that energy, that potential. So yes, it's all about digestion.
How does herbal medicine differ from something like caffeine or prescription stimulants?
Certainly. So there are herbs that can act like that. I mean, certainly if you look at both coffee and, say, tea, Camellia sinensis, or what we consider green tea or black tea, those are herbs, right? They have the
Because
ability to stimulate digestion. Pardon me?
you mentioned ginseng, so
Yeah, no, certainly. So, if we do look at something like that stimulant, okay, it's going to, herbs and plants can stimulate directly without building up the digestive system. They can go directly to, say, the adrenal glands, or go up to the brain and say stimulate or suppress this or that. And this is what we see with like caffeine based supplements. What's different is it's kind of getting to the foundation when we're looking at herbs. So what is your natural tendency? So when you're born, what does digestion look like? Free of any kind of adverse substances like potential stimulants, okay? Your body knows how to produce energy. Well, over time, with incorrect living, incorrect lifestyle, you would say, in one respect, not sleeping enough, not eating correctly, not drinking enough water, not moving enough, not having the right mental, emotional state. Over time, these functions can be depressed, okay, not be fully active, okay. And so an easy way to produce energy or get them active is, say, eat, you know, sugar. Okay, sugar is an easy energy. Or you use
right.
caffeine. Caffeine stimulates the adrenal glands, right? So it's easy energy. But what happens is we're never getting to the root of how we produce energy in the first place. We're using secondary sources of energy, which we know over time are depleting. At the same time, when our digestive system's not working fully, one of the um, one of the primary symptoms of that is low energy. But what's a secondary symptom? Things don't heal as well as they used to. Okay. Then we have mental emotional health. It's not working as well as it used to. So if we use herbal medicine to get the root, stimulate those natural processes, then we have true production of energy, not what would appear to be a secondary or artificial source of energy, like stimulatory drinks or pharmaceuticals or drugs. Okay.
Yeah, that makes perfect sense. Well, you mentioned plant-based support. Let's talk about something accessible more to like the general public. How does lavender reduce anxiety?
So it seems like lavender will go right to, now we're talking about the idea of what's called organoleptics, or using smell to influence functions, okay, primarily brain functions here. Okay. So if
Yeah.
anxiety is based in what we call the limbic system, which is kind of like our fear system or emotional system within our brain, the limbic system, it seems that from a organoleptic perspective, or a sensory perspective of using the smell, okay, the vibration or the energy of the smell, it seems to go into the limbic system itself and kind of reset it. Okay, so we find that when we smell lavender essential oil, you know, there's this direct connection to our brain. They found this with aromatherapy, that it has the ability to, we're not directly going through the digestive system, we're going straight into the brain. This is why they say you have to be careful about being around certain noxious substances when you're smelling them, because they can go past the blood-brain barrier and cause toxicity within the brain. At the same time, we have the ability of using something that will kind of go in and reset. You have to think about how we have adapted over, say, millions of years with plants, how long we've been around, right? But
Right.
these, whatever is on the earth, for as long as it's been, we've adapted to the use of plants. We've grown with them, right? And so we have found that uh, for the most part, these work with our physiology very well. So if you have anxiety, something like that, if you can use like this substance that's very rooting, because we talk about in Chinese medicine that anxiety is being unrooted. So if you're grounded and you're rooted, oftentimes this energy kind of just works its way through. We talk about grounding, like grounding the electrical system. Okay. It's like you're taking that excess out, and which is part of physiology. You get an excess there, and what happens to that excess? Well, if you're grounded, it should be sent out ideally like through your feet into the earth. Okay. When you're not grounded, it kind of floats up. Okay.
Right.
And so in Chinese medicine, we would say anxiety is an affliction of the heart going up to the mind and never quite resolving. And I think the way plants work is they, in one respect, have the ability just to ground us. It's very much earth energy. Okay. It's very grounding. And so in one respect, it's almost like giving us a sense of comfort and safety. And then that anxiety or that energy that's kind of has risen up has now can descend back down to where it needs to be, which typically we'd say in the lower dantian or the sacrum or something like that, where we connect with the earth. So it seems to work on the limbic system dynamics. Okay. So instead of being in a state of fight or flight, it says you can relax, you can take a breath, everything's okay. That makes sense to you.
No, it does. So if someone wanted to bring that sense of stability or aroma into their home, what would you recommend them doing?
Certainly, you can get an essential oil. You can put it in a diffuser. Okay, so I like to get, I have lavender essential oil in my house. And so I'll take a few drops, I'll put them in what's called a diffuser. And what a diffuser is, it's just essentially, water, that essential oil that sits on water, and then it kind of circulates that water and sends it out as a mist. Okay. What we know about essential oils is they're very volatile. Volatility is a term that we use specifically for this type of product. What it means is it is very quickly moving, very strongly moving. Okay. So essential oils have this ability to expand and to move. Well, part of it, again, what we see in something like anxiety or other mental emotional issues is a lack of movement. Okay. Things are kind of stuck. Okay. You get stuck in the cycle. And then we use something like this, and what it does is it kind of breaks that up and moves it. Well, much like it within us, it does it within the air. So it has the ability to move and permeate all substances. And if we can buy into this idea of that plants have a vibration to them, and we're vibratory beings here, and plants have a certain vibration. And when you extract the essence of that plant, say in like lavender essential oil, you're bringing out this very strong vibration. It's almost like the essence or the spirit of the plant. Okay. And so when we bring that into our environment, it seems like it kind of vibrationally lifts us up. So one of the best ways is diffuse that essential oil throughout the house. In the past, especially in like European medicine that was brought over here, they would make, say, a lavender sachet that you would sleep with at night, and that would resolve or calm you. Okay, so those were specifically the flowers. So we find that you can have the flowers and something like that where you're picking up that scent constantly, or you could put it in a diffuser, or you could use some essential oil on points on the body. And there are many techniques for doing that. What we usually find with lavender is the essential oil is one of the best ways to go. However, you can make a lavender tea. And I've personally used like a lavender chamomile combination as a soothing tea. So we can use it in that way too. So whatever form you get it, as long as you're smelling it, it seems to be very beneficial.
And you practice acupuncture in your practice as well.
Yes.
Can you explain what acupuncture is, as if I were a child hearing it for the first time?
Well, certainly, and I treat many children, and they look at me funny and say, "What is that tool you're using?" And I say, "Well, oftentimes with children, we're not putting needles in the body; we're just stimulating points." Okay, so acupuncture essentially is defined as a system of medicine that uses specific points on the body that have a function of moving or tonifying the energies of the body. So we would say that there are energy pathways all over the body. I believe, the classical texts in Chinese medicine say up to 72 pathways or routes of energy in the body. And so these are all over the body. And we have discovered these specific points that will interact with these pathways of energy. When the pathways of energy are working, the body is working. Okay. This is where we feel good on a daily basis. Okay. When we get sick, those energy pathways may be a little stagnant. They may not be moving effectively. So we found these points that when we either stimulate them with our fingers or a piece of metal or something else, it will excite this movement again. Okay. So when I'm working with children, I'll explain to them that when I touch a point with, say, a metal instrument, okay, I'm not going into the, acupuncture will go into the skin to a certain depth. But with children, I'll use just a metal instrument and I'll kind of like stimulate the point pretty superficially, and they'll feel it. They'll know. They'll say "ow" sometimes because it's kind of a metal instrument, but they say, "Wow, that I did feel something." I hear kids saying that all the time. I felt something move. So I'll say, "Yes, what I'm doing is, things weren't moving as well as they needed to, and when I touch this point, now they're moving." Now with needles. And we use, with older children, we use needles. In adults, what we're doing is we're stimulating that point electrically. Because if you think about putting a piece of needle or a piece of metal into the skin, what we're doing is that metal has this, electrical conductance, has the ability to interact with electricity. We're electrical beings. So when I put one needle here and one needle in a second point, what we think is happening is movement of energy between these 2 points. And it seems that movement of energy has the ability to help resolve this kind of stagnation or lack of movement that we determine is happening. Okay.
I never thought of it that way.
Yeah, it's really an electrical and energy medicine. If you've ever heard of energy medicine, like polarity therapy, cranial sacral therapy, Reiki, anything like that. It's acting essentially in the same regard here. It's in the same way. It's moving energy from point to point. Yeah.
One of the
Like a
biggest
polarity.
misconceptions is that it hurts or that a person feels pain. Can you debunk that?
Completely depends on the person. Typically, we're using such fine needles. I mean, these needles, number one, are not hypodermic, which means they don't have a hole in them. They're just a solid, small piece of stainless steel, but they're as small as a human hair. Okay.
Right.
Typically, when I put a needle in somebody, unless I'm really stimulating that needle, and we have reasons for doing that, the patient will barely ever feel it. They may feel the initial poke, okay? At worst, can feel like a bee sting. At minimal, feels like nothing. And I would say at least 50% to 70% of patients never feel anything when I put the needles in, okay? We have that initial breaking the skin, which again, oftentimes you don't even feel, and then we go into a bit of a depth, go in just a little bit to reach the chi, is what we'd say. There's chi at each point, and chi is essentially the energy that we're trying to reach. So we go and we try to find that point. But for the most part, I would say, and myself having received acupuncture for many, many years, it is for the most part very pleasurable. Actually, it's not painful at all. And it feels like this great release when I have points done. But of course, on occasion, we are putting a small needle. You may feel a little something. And I was working with a 10-year-old child today, and she's pretty sensitive to needles. And I did put a needle, and I said, "How did that feel?" She's like, "Well, it just felt like a little prick, but it's fine." And she was pretty sensitive. So if a child at 10 years old can handle it, most adults can. And I remind people who have tattoos, I said, "You have a tattoo on your body. It's not going to feel anything like that." And So I would say the majority of people have had acupuncture, have a very good experience with it and good response. And, that fear quickly evaporates after the first needle's put in.
You said you yourself had acupuncture. How come?
Well, I've had acupuncture. I would say probably my first experience with acupuncture is I had some low back pain. I was, in kind of not an accident. It was, like climbing. I was a rock climber accident, and I kind of fell on my sacrum and I put it out of place. And I had it repaired at the time by energy medicine, interestingly enough, something else I practice. My teacher and practitioner put it back in place. And then years later, it kind of went out of place again. And I don't know if anybody's ever had their sacrum go out of place, or excuse me, not sacrum and coccyx. If you've ever had that go out of place, it can be very painful to the side that it's tending toward. And so my health insurance at the time covered acupuncture, and I got a referral to an acupuncturist, and I'd say this is back in probably 2009. I had my first acupuncture session, and it was phenomenal. I felt things I'd never felt before. I felt a release, like both emotional and physical release, like I physically felt things happening. It's almost like I felt this tense muscle unwind. I felt this euphoria almost when I had certain needles put in. And now the experience was you put in needles, you're typically lying down, and then you rest for some time, maybe 20 minutes, maybe 25 minutes. And I will tell you, during that experience, I just felt like invigorated life within me. Okay. And every time I got it, it never felt long enough. I'm like, oh, I'm just feeling so good. I don't want to leave, because you're in the state of stillness. In one respect, you would say a state of like deep resourcing is the term we use in cranial psychotherapy, deep resourcing for the body. And it's a very what we consider parasympathetic dominant state. You're in the parasympathetic, you're in the rest and digest state. So many of us are never in that state. We're usually in the fight or flight, sympathetic dominant. So it really seems to stimulate the parasympathetic system. And so, I had a number of treatments going back then for about a year and a half, and it was so phenomenal that it really made me think differently about how the body worked and about medicine in general. What is medicine? Okay. Does medicine always have to be some strange or invasive procedure, or can it be something light and healing and fun and pleasurable? And so, that kind of brought me into that type of medicine I want to practice, because I was actually pre-med in college and was going down that route, but for some reasons I never got into it. So yes, my first experience with acupuncture was quite profound, and I would say since then I've had just profound experiences with it.
That sounds like it really changed the trajectory of how you practice medicine.
It certainly did. Certainly did.
For some,
It gave
for
me
someone,
tools that I did not necessarily have before. Yes.
right? For someone that may be having trouble sleeping or difficulty sleeping, what are the benefits of acupuncture for someone struggling with sleep?
So the beauty of both natural medicine and Chinese medicine, how we look at sleep, is that it's very individual. Okay. So in Chinese medicine, we look at patterns of disharmony. And how many patterns are there? Well, there are many, many patterns. Okay. What is a problem to you is not necessarily a problem to some other person. Okay. It's individual. In Chinese medicine, we may say that your heart is the reason your heart's not settled. In another person, we may say your liver is a little overactive. In another person, we may say that your kidney has a little too much heat in it. Another person, we may say you've got too much lung heat and it's harassing your mind and your heart. So the beauty of natural medicine, specifically we're talking about Chinese medicine here, is that it has the ability to treat the person, not the symptom or the illness. Okay, so many different possibilities with insomnia. Now we know with insomnia there's been many studies in a rich history of use of acupuncture and Chinese medicine to help heal insomnia. We don't say heal in terms of a Western diagnosis because that's not the way we work, but balance the body out so the symptom resolves itself. So we find specifically in acupuncture, there are points on the body that specifically within their name, and these names are all in Mandarin Chinese, there are points on the body that specifically talk about sleep. Okay. So we can utilize these points, but going beyond that, we look at the underlying pattern and we help balance that pattern. Now, with Chinese herbal medicine, we have many approaches. Is the approach that you need to nourish your heart and your spleen? Is there another approach we have to take, again, that we have to clear out like heat within the kidneys? Is there another approach that the liver is a little unhappy and not, and producing a little too much heat and not circulating the blood that it needs to, as we see in Chinese medicine? Lots of possibilities there, and we can use herbs specifically for all of these. And you wouldn't imagine how many herbs are specific for sleep issues. You're talking in the hundreds. Okay. But we tailor it to specifically the underlying physiology of the person we're working with, and potentially the constitution. Okay, so we know, you can take, in the West, we think about taking chamomile, or you think about taking lemon balm or something to rest. Okay, this is another example, and I practice Western herbal medicine too, and sometimes we go with something simple like that to kind of take the edge off. Okay, but when it's deeper, it's more chronic and more pronounced. I work with people who haven't slept well for 30 or 40 years. Their body and their psyche and their mind and their brain and their system is in a pattern. Okay,
Yeah.
it's habitual, and so we have to work at breaking this. And sometimes we'll go with a stronger approach of giving some kind of sedative action with both acupuncture and herbs, and then what we call tonifying action, which is help build up that's deficient, that's causing this. Okay, so you'll see a lot of approaches with some sedation, but typically we're going to use what are called nervine herbs. Nervine herbs support the nervous system health, either by kind of resetting it or helping repair it.
Well, you've referenced some of the balances that acupuncture brings and how it brings that normalities, up to balance. Are there any side effects that people should be aware of?
Acupuncture has very few side effects, but of course it can have side effects. It's obviously, if I'm inserting a needle in the body, there could be a little bruising or a little bit of itching at the site. Though typically uncommon, but you can see that. Obviously, there can be a little pain, especially if you go, strongly into muscle. There's this practice called dry needling that's practiced by a lot of the Western community, where they'll specifically take acupuncture needles and strongly stimulate muscles or tissues or whatnot. Okay. It depends on the person doing it, but oftentimes a strong stimulation. Well, that can cause tissue damage. It can cause pain. Acupuncture is not that. Okay, that's not what we're doing. We're not strongly stimulating muscles for necessarily physiological action there. What we're doing is we're interacting with acupuncture points and channels of energy. And so ideally what we're doing is we're feeling as we're putting in, and this is something about becoming a practitioner. You become very sensitive to energy. You become very sensitive to the body, individual bodies. So as I put a needle in, I'm interacting with, if you can get your mind around this, the patient's chi. And the chi is going to direct me to what it needs. So once I put in that needle, then the body directs me. Okay. So I'm working with the body. When you're working with the body, usually it's pretty free of side effects. Okay. If I'm, in the rare occurrence of trying to stimulate a muscle to fire that's stuck, I may give a little bit more action, which is kind of like a little in and out or twirling of the needle, which again isn't really painful. One of the possible side effects of that could be just a little bit of bruising underneath. But for the most part, we're pretty free of side effects. And again, why so many people are coming to acupuncture now is that it doesn't cause long-term side effects, and it's very healing, they find. We do incorporate other practices like moxibustion, which is burning mugwort, which is an herb over a point, and typically it's off the body. Okay, like maybe I have something like this, and I light it like a cigar. It's called moxibustion, and maybe I burn it over the body like this, and I'm about an inch off. And this is heating. It's like infrared radiation, like infrared, which we find is getting a lot of attention now. And this was actually the precursor to using needles in Chinese medicine. Actually, was using moxibustion. You're talking thousands of years ago, and they find that this almost works as good as needles. Okay, well, what is one of the side effects? Well, it could potentially burn if somebody's not paying attention, but for the most part, we're paying attention because the last thing we want to do is burn our patients. So besides that, there's not really much side effect at all. Yeah, it's usually a good experience.
You referenced the body's chi.
Mm-hmm.
What does that mean exactly?
Well, the radical, and radical is going to be a Chinese symbol. The radical for chi is actually a pot full of rice that is steaming up over a fire. Okay. And so in, classical Chinese ideas, the perfect food was rice, because rice was very tonifying to the stomach, to the earth. It was the perfect food. It was easy to break down, and it provided the building blocks for energy production in the body. And we know how revered rice is to so much of the world. It is the staple. Okay. And so this symbol of rice cooking, the chi aspect of it is going to be the steam coming off. Okay. So we go back into try to truly understand what chi is. I believe there can be anywhere toward 100 different ideas or translations of what chi is. Okay. But in essence, you can think of it as potential energy. Okay. People talk about us sitting in an ether of energy. Okay. Energy is all around us. Okay. So we can't see it necessarily. We can learn to interact with it, but we can't necessarily see it. Much like they say the wind, you don't see the wind, you just see the effects of the wind. Okay. Once you learn to harness this energy, okay, which is all around us, then it becomes some potential action. And I believe that's what chi is. Okay. Chi is many things and it's nothing at the same time. But when you hear these words, they pretty much talk about it's the energy of the body. Now, what is the energy? Well, the energy is kind of like the fuel, the fuel that makes the body work. Okay. At the same time, it is that working of the body. Okay. When we say the liver chi is flowing, what does that mean? Well, it means that everything the liver does in the body is functional. Okay. So it's kind of like the potential energy is a way we would think about it.
You're experienced in finger pressure and the push and pull forms of massage therapy. Can you break down the differences between the two of them?
I'm sorry, one more time, the finger pressure and
the push and pull form.
Push and pull form of Tuina of Chinese medicine?
Yes, sir.
Yes. So certainly. The question is, what are we trying to do with Oriental medical massage or Chinese medical massage, which we call Tuina, which is push and pull. Okay. again, this form of medicine was, I believe, developed to, number one, work with the energies of the body, number two, to work on the physicality of the body. Okay. So if I'm using just a pointed finger approach, like stimulating like acupressure or stimulating certain points, the point of the one finger is oftentimes very local action to stimulate, say, a point of energy or a muscle or something like that. When I'm pushing and pulling, I'm working along the fascia of the body, the tissues of the body, and the energies of the body. In true Tuina or true Chinese medical massage, and then we can even bring in shiatsu, which is Japanese type of massage, is an energetic medicine first. What we're doing is we're working with the energies. So we start very superficial. And oftentimes when I'm doing this type of work, I'll almost do just touch therapy, balance some energies, and I'll slowly start working with the channels of the body, going at the very energetic level, which is superficial, and then keep going deeper and deeper to the muscular level. And sometimes we say to the bone level. Okay. So we use these pushing and pulling ways. Okay. So pushing is like pushing the energy. Pulling is sometimes pulling the energy back. So pushing is getting rid of excess and pushing it out. Pulling is bringing in that energy in a tonifying function to build the energy. Okay. If the energy is too above, as I was talking about before with insomnia, oftentimes the energy rises. We can pull it back down to the lower part of the body. Okay. And or pulling can be something like giving stretches, pulling on the arm to give some kind of traction within the joints. Because the biggest obstacle we run into in medicine is stagnation, things not moving, things getting stuck. Okay. When things are stuck, chi doesn't move, blood doesn't move, fluids don't move, nerves don't fire functionally. So sometimes we're going to push to break that up, and then we're going to pull to give traction to allow for space for that to move. Okay. So I'd say the difference between pushing and pulling is that one finger is just stimulating certain points on the body, much like an acupuncture needle, to stimulate those points.
And how does a client's daily lifestyle change how you approach the pressure points?
How does a client's daily lifestyle change that? Well, certainly, if a client is living with, say, the environment, okay, if we look at traditional medicines, they talk about our interaction with the environment. You certainly, rise with the sun, retreat with the sun when it goes down. You certainly are going to eat foods in that season because that was what was available. Okay, in the summertime, you're going to spend more time outside. In the wintertime, you're going to spend more time inside, right? So we live with the environment, okay? And then there's a saying in what's called the Huangdi Neijing Ling Shu, the Yellow Emperor's internal medicine or canon of internal medicine, spiritual pivot called the Ling Shu, which is one of our foundational texts. And they said, it's a conversation between the teacher and the emperor. And the emperor asked the teacher, why did we used to live 100 years and now we don't anymore? Why do we have illness when we didn't used to have illness? And the teacher tells the emperor, because people are not living with the Tao. They're not living with nature. And the Tao is all about nature. We call that, right? So we're not living with nature. So how does that apply in medicine? Well, if people are engaging in excesses, okay, overeating, or they're not eating the right foods, or they're not drinking enough water, they're not moving, and they're not working on their mental emotional health, okay, they're not reining in excesses, right? If you're not moderately drinking but drinking too much, or you're not moderately eating but eating too much, that becomes a hindrance, obviously, to health. So when a patient is not, or a client is not pursuing a healthful lifestyle, that makes my job a little bit more difficult, because now I have to work with undoing what they're doing. So part of how we approach medicine is that we do a lot of lifestyle coaching. Okay. So you're getting to bed too late. Well, the body actually wants to go to bed at this time. Okay. Your body's calling it out. Okay. Because you're telling me that you go to bed at a certain time and then you wake up a certain time. I look at patterns. I'm like, okay, well, this pattern's saying that you need to go to bed a little bit earlier. Okay. Or your body's telling me that you need to consume more water, less sweet tea, more water. Or your body's telling me that you're eating too much fatty food or processed food. You need to get a little bit cleaner. Okay. When they engage these recommendations, it makes my job easier. And what does my job easier mean? It means they don't have to see me as many times. Okay. If I'm doing my job well, I will see a person for so long and then I can send them off and then they can maintain on their own. Okay. And again, you were asking the difference in Western medicine and Chinese medicine or natural medicine. Oftentimes it's exactly this. You get on a drug in Western medicine, oftentimes you're never going off that drug. Okay. Unless it's used for an acute situation, oftentimes you're not going to go off of it. If we're doing our job right, you go off of it. Okay? You don't need it anymore. Okay. But again, this is cooperation. Okay. The person or the client has to do their part. Okay. And one of them is recommendations. Number two is if you really desire to heal, oftentimes that has made you sick, you need to do the opposite of. Okay. And oftentimes it's lifestyle. So you work with me, I work with you, we get there faster.
Well, based in your experience, what behavioral lifestyle, have you seen from other people, and what would you recommend they change from it?
Yeah, I would just say that, stress is a major problem. And a lot of people don't know how to contain their stress or handle their stress or resolve their stress. Okay. You think about sitting in front of a computer screen, you got blue light coming at you, the body, it seems like the body interprets blue light in not a very positive fashion. Okay. It seems like it's kind of insulting a little bit, right? Um, I was listening to somebody recently that said, if you look at both incandescent bulbs and the sun, they're mostly red light, very little blue light. Well, you look at LED bulbs and your computer screen, it's mostly blue light, not red light. Okay. And what we find is that red light will stimulate function. It seems like blue light, from my research on this, hinders function. It slows function down. Okay. And so certainly, I worked for many years in an office. I worked in DC in the government for many years. And I started realizing the more I was healing myself that about every 15 minutes I had to get up and leave my screen and walk around. Okay. I needed to move because my body was saying, this is health. Okay. When I would eat at my desk under stress, later on I would have problems. And in my exploration of health, it said, don't do this. Remove yourself from the situation, eat, go take a walk, and then come back and work because you need to be eating in a relaxed state, not a stressed state. Okay. You're thirsty, drink water, don't go for other substances. Okay. Reduce these substances that take water out of your body, like excess caffeine or excess alcohol. Okay, if you're drinking too much alcohol, why are you drinking too much alcohol? What's the rationale? Is that a good thing? Let's work on reducing this. So again, if you're not moving enough, again, you're working in an office building all day long, you may have limited movement. Okay, well, you need to start moving because movement is health and life. Lack of movement is the opposite, right? So my recommendations with patients is you need to start doing this. You need to start engaging this, okay? Because again, I can do acupuncture and I can give herbs, but I can't override what you're doing every day all the time. And this is the thing about natural medicine. There has to be the conscious desire to make a change in your life. Okay, you have to undo what you've been doing. So I would say the major hurdle is stress. But with stress, lifestyle choices. Like I said, eating a lot of the wrong type of food, eating too much of the food, eating too late at night, not moving, spending too much time in front of blue light. Okay. What do I find healthful? Interacting with people, having friends, having good family time. Okay. Having an animal that you can take out and walk, getting out in nature. Okay. These things reduce stress. These things help improve digestion. These things help overcome pain. Okay. And so that's the desire here, right? To feel the best that we can. Um, and so whatever is going on for you, we have a way to help you overcome it. So that answers your question.
But does it? It sounds like the stagnation. When we really just stop, that's when we start regression.
Yes, certainly. Yeah, again, stagnation. You think about it, right? There's this idea in Chinese medicine called blood stasis, and this is stasis, stagnation. Things are not moving as well as it should. When your blood's not moving, you know, your tissues aren't being oxygenated as well, and waste products are not being cleared out as well. And what starts happening? Acid buildup. Okay, what we call tissue hypoxia, not enough oxygen. Okay, well, if energy production requires oxygen, which it does, if tissue healing requires oxygen, if movement of fluids and tissues require oxygen, when this is not moving, then tissues start breaking down. So as I said, when you have too much, say, carbon dioxide and hydrogen that hasn't been moved out, okay, this is the waste products of metabolism, haven't been moved out, they start acidifying and creating heat within the tissues, and then we start getting inflammation. Okay, so what do people typically do when they get inflammation? They take an anti-inflammatory. Okay, well, that's not fixing the issue about why you're getting heat there. Your problem is a lack of movement. Okay, so again, there's a term called blood stagnation. There's these ideas, especially as people get older. I specifically have this book called Aging in Blood Stasis. And so what we find is that the major cause of illness, especially as people get older or are sedentary in their everyday life, is stasis, okay, or stagnation, lack of movement. We know that you're on an airplane too long and you're not moving, you could get, say, a deep vein thrombosis, okay? You get stagnation, things don't move, we produce a clot. Because if blood's not moving, it produces a clot because blood coagulates, vitamin K, blood coagulates. So the same with chi. If we're not moving, chi can get stagnant. It can grab onto fluid substances and whatnot and start creating what we call phlegm in Chinese medicine. Phlegm is one of the major problems that creates blockage of energy flow. Okay, so stagnation is kind of like again, we said, movement is life and lack of movement is essentially death. Well, that's kind of the beginning stages of it. So the first thing we do, and primarily, I think one of the major benefits of acupuncture is it gets energy moving again and it gets blood moving. I can put in a needle and the hands may be cold. I put in a needle and the hands warm up. Okay, we're getting blood flow. We're getting energy flow. Okay, patient feels better. Person feels better. Okay, I've got more energy. I'm thinking clearer. I have better digestion. I have better bowel movements, right? You're like, yes, because we're getting the energy moving because you're backed up. So again, we have to undo the backup, right? We have to clean it out. Sometimes you got to purge it out, but then we have to support the body to naturally not get backed up again. Right.
It all kind of boils down to restoring that natural balance in your body.
Absolutely. It's all about living, and functioning optimally. Okay. What is optimal function? There's a lot of supplement or people out there will say, this is how you live optimally. You take my supplement. My supplement costs this amount of money. I'll see people all the time on multiple supplements and not feeling better. And I'll say, well, it's not really about that. It's really about optimal movement of energy. Okay. The more the energy moves, it seems like the better the functioning of the body, and the better the functioning of the body, the more energy, because that has the ability to produce that energy. So, yeah.
When it comes to like the tension in the body and when you're observing or applying these therapies, when it comes to the tension, do you see more physical tension or like emotional tension in patients?
Well, I'm going to tell you, it's another adage in Chinese medicine is that 80% of illness comes from emotional factors. Okay. Is physical tension due to emotional tension? Where does it all start? Okay. Or is it the body's physically tensing that then affects the emotional side, right? Or are they separate? Well, in Chinese medicine and natural medicine in general, we typically don't separate the mind and body. Okay, one produces the other. Okay, one influences the other. And again, with that idea in Chinese medicine that say 80% of disease is caused by emotional factors. Okay, um, I would say that number one, they're part and parcel with each other. I would say most people I've seen that have muscular tension or tissue tension have emotional tension, have mental tension. Okay. So I see both. I don't separate them out. I always work on what we consider mind, body, spirit within each individual, which means I'm settling what we call the spirit, whatever you want to classify that as. We're working on the mental, emotional body, and at the same time the physical. And there's a saying in natural medicine. You know, it goes way back, but I know the homeopath Samuel Hahnemann, who the founder of homeopathy, stated well, and then it was picked up by Dr. Herring that um, uh, there's a step down process of energy. Okay, it starts on the spiritual level, goes to the mental level, goes to the emotional level, and goes to the physical level. By the time it resides within the physical level, it's already been well working on those other levels. Okay, so in homeopathy, if you ever look at remedies or you ever look at approaches for homeopathy, it's going to work on the body, the mind, the spirit, all of this, right? So I don't separate them out. If there's tension in the body, I assume there's going to be mental, emotional tension at the same time, and I treat them both.
Because you can't truly heal a body element without the emotional element being healed as well.
Well, what I would say is, what is the etiology or what is the foundation here? Okay. You have a traumatic injury, like you fall, you get hit somewhere, the body kind of like tightens up, the tissue tightens up. Okay. Now, how does that affect your emotions? How does that affect your mental state? Are you protective of the area? Are you a little less trusting? Or are you a little bit more heightened? I work with a lot of motor vehicle accident patients. Okay. And yes, they may have like whiplash, neck pain, low back pain, but the biggest thing I deal with is PTSD. Okay. If they're having this tension in the mind, it's causing tension in the body. It has to. Because it's a protective. If you think about tension is like a protective mechanism. It's like having a hard shell or armor. What I'm doing is I'm tightening, I'm covering my body, making it stronger and tighter to be able to handle outside forces. Okay, I'm protecting myself. But where's that coming from? It's coming from the mind. Okay. If you can get on board with me there. It all starts up here.
No, I agree. They're correlated. When we talk about the body a lot, what in the winter affect how the body, performs in the summertime?
Say that one more time. I'm sorry, I didn't completely catch you there.
How does what we do with our body in the wintertime affect how our body performs in the summer?
Certainly. So they say during the winter should be not a great amount of external activity. You think about cultures that were exposed to the elements, and a lot of our traditions have come from the north, at least in this country. In China, it came from a lot of it came from northern China too. And so what they learn is during the winter, you bring everything in, you don't exert too much, and you spend the winter nourishing and building up, right? Kind of these reservoirs. Okay. So if you're living ideally, you're eating foods of the season. You're eating what we consider more yin substance foods, which are, heavier protein, fat types of foods and less carbohydrate types of foods. This is going to be long storable energy. Okay. If we're living according to the seasons and nature, that when we go into spring, there's going to be all that, building metabolism that's happening. When we get into the spring, then we do a lot of cleansing. Okay. Now we kind of we'll get back out into nature a little bit, and slowly we're kind of opening things up again, and we're cleansing. Okay. And we're building towards summer. So the types of foods we see in the spring, or certain desires for certain types of foods, are going to build to the summer, right? So what we're doing in the kind of like the opposite times is during the summer, we're cleansing. Okay, we're clearing out the old to be able to bring in the new during the winter. In the winter, as long as we're doing it, we're building those resources and building that new tissue that builds and gives us vitality for the summer. Okay, so it's pretty much an opposite approach. In the summer, we're very much out into the external, so we're consuming lighter foods, more fluids, like something like watermelon, or more salads or lighter foods. Whereas during the winter, we're going to eat more or heavier foods like meats or oils or something like that, or root vegetables. Okay, and as long as you're following the seasons, it seems like sickness is not as common. Okay, so that's kind of my opinion here on that.
I mean, currently we're at the back end of winter. What preventative
Yes.
treatments should I or someone else seek to prepare for the summertime? What should we be doing currently?
Okay, well, certainly, winter's not a time that you would be into a lot of stimulation. You want to be in more internal, being more internal during this time. So certainly lack of stimulants, so probably reduce caffeine a little bit, reduce alcohol, reduce stimulating food. Again, go with more of those nourishing foods. We're making this transition. What happens now, the body's like, we're ready to open up a little bit, but not fully. We're ready to open up a bit. So we start, if I'm doing 100% of, say, nourishing foods and heavier foods, I'm going about 50-50. So I start bringing in more fresh foods, fresh fruits and vegetables. Might start taking some more teas that are kind of getting more movement. Okay, so like stimulating teas a little bit. Okay. Probably a little bit more, as I said, half fresh foods, cooked foods. Okay. A little bit more activity during the winter. There's less activity. We're getting outside a little bit more activity, but we're slowly building. Okay.
Yeah.
So these are the practices we're going to use. As you go towards summer, you'd say ideally, if I'm following the sun cycle in summer, probably sleep less in the summer, more in the winter. Okay. Kind of half. You're not sleeping as much. You're getting up a little bit earlier in the spring. You're getting more active early on. Okay.
Well, you're talking about the transition between like winter, summer, spring, and so on. How do our internal rhythms relate to the rhythms of the world around us?
Well, again, we're very much connected. There's this Hermetic saying, as within, so without. So what's going on outside is going to be reflected inside. What's going on inside is going to be reflected outside. So again, if I'm, like I said before, if I'm following the natural rhythms, I'm going to, as the sun comes up earlier, start awakening with the sun. As the sun goes down later, start going down with the sun. So that would be the diurnal rhythm, okay, following the sun, or the day-night cycle. Okay. As far as foods, we should be eating foods that are coming into bloom. Okay, so if we think about like leaves and flowers or whatnot, this was kind of the idea, right? What about if we're eating meat, what is coming to fruition at this time? Okay, so we're going to follow these rhythms. As far as like movement, again, as I said before, during the winter, it's more of a solitary time. We're starting to kind of build up movement. During the winter, they say you really shouldn't be sweating because you expose yourself to the elements too much and you let cold come in. During the spring, we're starting to sweat a little bit more vigorous movement. little bit more walking, a little bit more, you know, as I said, activity, which will peak, say, during the summer. So again, it's like coming out of hibernation. How would a bear come out of hibernation? They're going to slowly do it. They're going to slowly get out in the world. They're going to calibrate in the world, acclimate to the world, okay? Get movement, probably get a drink of water, and probably go find some food. But are they going to binge? Well, maybe they'll binge initially, but the thing is, when you've been fasting for a while, you don't necessarily want to jump into a full meal right away. You're slowly building up. Okay. And so we can think of it that way, that spring is not going to need this like heavy type of food. Things start getting a little bit lighter. And ideally, as you go toward the summer, you eat less because the requirements are not there. Because if you did what you needed to in the winter, the body has the storage to make it into summer. So it's like a slow coming out of hibernation is the way you can think of it.
I like to leave all listeners of the podcast with a final thought from my guest. If someone listening wants to begin aligning with their body more intentionally, what's one small step they can take this week to do so?
Certainly, I'm going to tell you, take your shoes off, go put your feet on the ground, connect with the energies of the earth. Okay, this is something we call grounding. It's a way of helping eliminate static electricity in the body. Okay, so many problems are due to the static electricity. So there's been a whole movement called grounding. And there's a reason we have a ground on our electrical outlets. Okay, this is to ground that energy. What if we don't ground the energy? It never quite resolves, right? And so this is one small step that can make a tremendous difference in your life. And what do I mean? Putting your feet on the ground for 15 to 20 minutes a day. Connect with the earth, rest, listen, be with nature. Okay? Get away from the computer, get away from the stressful environments and do that and see how your life changes.
Dr. Whyrick, thank you for helping us, connect our mind, body, spirit, and realizing how they all balance together and come to be one.
Thank you. Well, it was a pleasure meeting you and being on your podcast today. Thank you for your time.